Welcome to the TLC podcast series, Let's Have a Chat About ChatGPT. In this second episode titled From Theory to Practice, How Can ChatGPT Be Used in Education? We plan to have an exciting discussion about the health science application of this technology. To help us out this conversation today, we have a group of rock stars lined up for you. Here with us, we have Dr. Greg Lobin from the College of Graduate Health Studies, Dr. Saroj Misra from the Clerksville College of Osteopathic Medicine, and Dr. Hanan Omar from the Missouri School of Dentistry and Oral Health. Additionally, two other rock stars guiding today's discussion are Brittany and Julie, friendly voices you already know from the TLC. Thank you, everybody, for joining us today. As our previous guest, Dr. Behrens, alluded to in the last episode, there are so many uses for ChatGPT. So to help us dive into this conversation, I'd like to start with the question for our guests. What use cases have you heard about that have piqued your attention so far?
Actually, it was very interesting because now, as any faculty or an educator, if you want to create exam questions, for example, how long it will take you to create 20 good multiple answer questions or one best answer questions, it will take you a lot of time. But with just a request to ChatGPT and providing the learning outcomes and what you need to create, you find yourself with 20 questions. They might not be great, but you're editing because you are the content expert. You know what to do with these questions. The editing time is definitely less than the creating time. So we need to think about these potentials from the educator point of view. If I get more time, I will be doing more important things than creating those questions from scratch. Creating clinical scenarios. I just randomly sat and say, okay, I want a patient at this age with this clinical condition and these situations, provide the scenario. The scenario was not 100% what I want, but it is definitely an editable scenario that can be modified with the right references, with the right literature. It can be very well used. So this is where I feel that we are heading. It's about, everything is about time saving. If I can do more in less time, that is an advantage. That's a plus.
I love that you're pointing that out. I think I always kind of chuckle to myself when I hear someone say, oh, but the time saved. We are very good at filling our time with other things, right? So we'll save a little time over here, we'll shift it over here, but you brought up some amazing perks. I think what's also very interesting is the creativity aspect that you're bringing to the table. I could prompt ChatGPT to say, provide me with exam questions in the board style that my students maybe need more practice with. And then you could whittle it down and give feedback to the AI model and say, okay, well, that wasn't quite good enough. I need it more in this context, or give it to me at this reading level. So I'm curious, are there any other applications with maybe board style questions or that creativity piece where anyone here might see an application for?
Yeah, it's really interesting because you've been talking about the creation of questions, but I think one of the other things that we've started to see some really fascinating work on is how things like large language models can actually help a learner to better understand how their responses were and were not necessarily correct in trying out board style questions. So in essence, these models can also be used to help train learners to be better critical thinkers. And by the way, that extends not just in the test-taking domain or the pure educational domain, but also in the clinical domain. So large language models have been used already to start to say, well, you were looking at this patient with hypertension and you kind of thought about these considerations. But here are some additional considerations that should lead you to think down this road. Now, we have that in a way already. If you look at things like the New England Journal of Medicine, they have some products that do that. The difference is all of that is pre-scripted, which means it assumes that a certain learner is going to say a certain thing a certain way every time. And we know different learners have very different thought patterns and metacognitive patterns. So what the charm of large language models is that they can speak to each individualized learner about their own learning patterns. And I think that's a really fascinating approach, not just about creating questions, but helping learners to think about the questions they have to answer.
Yeah. Can I ask a follow-up on that? How, as educators, can we help students develop those skills? How do we help them engage with this tool when it's now available, as a way of practicing those critical thinking skills, as a way of thinking about clinical practice, the board exams? Essentially, what role do educators play in preparing their students for a world where this technology is available?
Well, I'm not a basic sciences faculty, so I'll defer, but I will say this. I think that we have to think about what are the things that drive people in terms of their own education. We'd like to believe that everybody is a learner just because, right? But we know that external forces often predicate what resources are utilized, right? So people use board study banks because they've been shown to increase board scores, right? So what I think we would have to do is start to demonstrate through proof of concept that when students do these things, they actually increase the value in terms of real world performance. Now that's from a large standpoint, but I defer to Greg and Hanan to talk a little bit more about their perspectives on that.
I believe that one of the important aspects is personalized feedback. So if the student respond to a question in a certain way and request for a feedback from AI, then he would be able to get that feedback. And I believe that even sharing that feedback with the educator and the faculty will reinforce the information, and we will enhance that. I kept giving examples about the educator because I still believe that we as the content expert would know better. But my fear is the students, because now we know that AI is up to 2021, and I'm not sure when it's going to be updated to where we are in knowledge, in literature, in whatever capacity. So I'm just still protective about my domain and my field, and I say, okay, I can make the judgment, but I need to believe at one point of time that I should equip my students with the skills that I should leave them with the AI, and I'm confident that it's going to benefit them and they're going to learn. So it's just about letting go and preparing them to that.
I'd like to make the point to build on what both of my co-discussants have brought forward here. So let's remember that large language models are just one type of AI, right? And they're a particularly powerful one. But what we're really talking about are sort of adaptive learning systems. So imagine AI in the position of being able to pay attention to a student that's using their iPad and recognize when the student is struggling or slowing down, and then being able to generate questions specific to the areas the student is struggling with. I mean, there's all sorts of potential for adaptive learning with AI to really personalize this educational system, which goes to this idea of like, how can it be effective for a student? How can we teach students to embrace it and say there are positive uses to this? Also, I don't want to do away with professors. I think there's always going to be a valuable role for that individual or those individuals. At the same time, these are supplemental tools that can personalize and individualize education. If we've got a classroom of 100 students or even 20 students, it's very difficult to personalize that, individualize it, especially in some fully online environment.
Right. Yes.
And Greg, no, not at all. I want to feed off a thought you had and tie it to what Hanan said too. The professors and the faculty are, in my opinion, should never go away. But what they're really going to be focused on is not necessarily the content, but rather how learners learn and how they can work with each learner to maximize their efficacy in learning the content. one of the interesting things that both you and Hanan alluded to is this concept that perhaps AIs may be able to give feedback to faculty about their learners, to be able to say, this 20% of the learners seem to respond better to this teaching style, and this 20% are having trouble with this particular topic. And what that does then is allow the faculty to actually curate the content and the delivery or the style of that content to the learners. So what you're talking about is absolutely right. And I think what we can start to see is some specific examples of how this might actually enhance faculty's ability rather than replace faculty.
Yeah. The flip side of that coin, and there's lots of concerns, but just to mention a couple, right? We want to always be transparent. So we don't want it to be that people don't understand they're interacting with AI and what role it's meant to play. And that's another role for the human element, for the professor. You know, how do we engage students? Part of it is we make very clear how we're utilizing, and we want them to utilize AI. And there's this balance between AI as a technology that monitors student performance so that we can help them learn, so it can give feedback to them without being too invasive, too intrusive. You don't want it. I mean, nobody likes the idea that my computer is studying me and recording everything, right? So there's a balance to be found there as well.
Yeah, I believe that digital literacy, the students need to understand what they are doing and what the capabilities of these AI models. They will never gonna replace a patient. They are never gonna treat the patient. So they need to understand their role as healthcare professionals, as dentists, doctors, nurses, hygienists, that they have an obligation towards the patient. And all these tools are there to support that, not to replace them. So the proper use of these tools always towards, they need to think that it's always toward better healthcare outcomes. If you get that idea across and prepare the students with the skills to understand what they need to do and how they can expand the use of AI models to support their patients, to support their lifelong learning, that would be the thing, that would be what we need to achieve.
So in one sense, I think one of the things that educators are going to have to really work on with students is a problem we currently have, and it's only going to get worse. And it's that students now have access to information. My authority as someone who tells the student what they need to know has dropped considerably, because now they walk around with all of the world's knowledge in their pocket, and they don't need me in a sense. What many people struggle with is determining what's reliable, determining if the information is accurate. And so I think there will continue to be a role there in education. This technology is here to stay, and it's going to continue to grow and change. What we need to do is learn how to use it reliably. Another is that, for me, education has always been involved with the introduction and adaptation to new technology. And in many ways, educators are always at the forefront of this, helping people learn how to incorporate tech into their professional life. At the same time, tech like this, much like the internet, has broad societal use. I mean, it's not just used in education. People are using it to develop exercise plans and figuring out gifts for their parents, and it's across the board. So lots of people will have use and exposure and interaction with it prior to using it in the educational environments in which we're going to want to engage them. And that makes it a little more difficult. It's already going to be part of their life. They already know it's here to stay, probably more than we do. Certainly younger students coming in will be more familiar with it in ways. So what we will need to do is say, there's more than one way to use this, and some of the ways we want you to use it here are different than the ways you think about using it. And that doesn't mean your way is wrong or this way is the only good way, but we need you to think about using it this way in this context. And that can be a difficult thing. That's a really important way to help people understand that complex technologies often have multiple uses. And, the sort of common one isn't the only or best one in the professional environment.
Greg, I want to tack two concepts on to what you just mentioned too, that I think educators have to be involved in. So the first is we have to recognize that today's doctors are also going to be the people who eventually upgrade these large learning language models to work better in medicine. So we have to teach learners how to think about the language models themselves and how they are incorporated, right? So really, we want to make sure that they're not simply utilizing the tool, that they're actively going to be working to improve the tool's functionality over time. So that's the first. And the second thing, which I think we all alluded to at the beginning of this when we talked about what worries us, is we have to teach our learners how to be thoughtful about the ethics of the use of these tools. Again, we have to pair the advantages that come with the tools for our learners with them also being thoughtful about where should we not use this tool, or what are the potential dangers of this tool? Because if we ignore that ethical conversation, or we leave it to just specialists, bioethicists, et cetera, then we're going to run into problems. We really need to make sure that every learner and every future doctor is considering the ethics of this.
Yeah, so I'm wondering, you were saying teaching our students, the importance of teaching our students how to engage with the tool and think about the ethics of it. I'm wondering if there's also an opportunity to help students think about their own metacognition. How can they use this as a tool to study? Where are their own gaps in knowledge? And I think you all mentioned that this tool has so many different uses. Greg, I think you said it so well, that a tool can, a wrench can be used for multiple purposes, right? But we have to find the right one. So is there an opportunity to use this as a way of helping students connect with evidence-based pedagogies, connect with what's the best way that I can study, or based on where my gap in knowledge is, how can I use this tool to my advantage? What do you think about that?
I think you're absolutely right. And really what you're talking about, especially in clinical education, right? So when we move away from the classroom, we've moved away from, pure pedagogical teaching to more of an andragogical approach and a competency-based or outcomes-based approach, right? So one of the things that these models can be potentially valuable for is not just teaching, but suggesting new experiences that based on what the models know about the learner, that will enhance the learner, their overall capabilities. So if a language model or an AI goes, gosh, you know what, you're not great with EKG interpretation, right? It might say to the learner, hey, you should consider doing an additional month of cardiology as an elective rotation to help you with this critical skill. And that's where I think what you're talking a little bit about, Julie, is that metacognitive process that these AIs can actually help learners to better understand not only how they learn, but where they could learn more.
Oh, I love this idea. One of the things that occurred to me when I was thinking about this upcoming podcast was the notion that new technologies require us to learn new things. But that's a really simple statement that covers a lot of ground. What it actually means is something like when new technologies are introduced, old things we used to know, we don't necessarily need to know anymore, or ways we used to learn or find things we no longer need to. And so what it is that we have to teach and how we teach it has to change along with it. So I love this idea of how could AI and large language models be used at a meta level to help learners figure out an educational system like becoming a physician may have to carve out more space and time for that actually to take place. And I don't just mean more space for a different instructor to come in and teach them their thing. I mean more space for the student to actually have some time. Because we currently teach students a lot of stuff that I wonder if they still need to learn the way they do. And it takes up a lot of time.
Greg, you are 100% right about that. And I was just going to say, I was just going to say that what has to shift is that we have to get away from the idea that knowledge acquisition is the currency of the educational realm. Knowledge acquisition is now an almost unconscious process. We don't need to teach our learners. I'm going to say, and I know this is going to really raise some hackles, but I'm going to say we don't need to teach our learners all the basic facts and things, the esoterics of all these biochemical pathways, medications, and things. We need to teach them how to find that data when they need it, how to take that data and apply it contextually to the situation they're assessing or performing in, and then how to reflect on whether those outcomes were beneficial or not. So if we were to shift our thinking and move away somewhat from data acquisition, especially in the foundational years of medical education, and move to application and synthesis and say, you don't need to know what the Krebs cycle, you don't need to know all the steps of it. You just need to know where to find it when you need it. That would allow that time that you're talking about that needs to be there.
Yeah.
I totally agree with you, Saroj, in that aspect, because I believe that our memory and our ability to memorize things, it has a limit. It is just, I need to find the information when I need it. It doesn't have to be there all the time. It is just identify where to get this information when I need it. And I believe with AI, there will be another thing is ask the right question. We always tell our students, ask the right question so you can get the right answer. And I believe that this will apply to a great extent with the AI and the ChatGPT.
I'd love to build on that, but in a simple way. So I'm currently teaching in an online program, and students run through a 10-week block, and they generally have some type of research and writing that they have to do on a weekly basis. And when you think about ChatGPT or these large language models' ability to generate written answers, you start to worry that students are just going to rely on it for all of their written content that they have to submit, right? Discussion posts or blog posts or short papers or whatever. So how do you utilize ChatGPT? How do you get them to engage it in a way that's meaningful? And my first thoughts are echoing you, Hanan. It's that I want to show them how to use the tool well. They have to learn how to ask it good questions, and not just once. It becomes a tool that is an iterative question answerer, right? So I might say to ChatGPT, hey, write me, a 500-word post on this, because that's what the instructor wants. But it's going to come back in a form that's sort of ballpark, and it's going to have good stuff in it, but I'm going to need to clean it up. I don't want students not to do that. I don't think I could stop them realistically if I wanted to. But what I want them to do is start to learn that first iteration isn't good enough. So now you have some data. It's given you stuff to ask it about more. What in that answer can you ask it about to go further into? And through this iterative process of multiple questions, you're pushing down into something instead of staying on the surface. And you have to figure out what's valuable in what you're getting back, and in a sense, synthesize that into a greater whole. So that's a way we can tell students, you don't have to memorize this stuff, but you have to learn how to ask good questions and then interpret the information you get.
That's true.
Greg, I love that you bring that up. The other thing I'll say is I've heard of instructors doing this currently, where they not only model it for them, but they say, okay, students, send me what the prompts you put into ChatGPT are. Tell me in the order and how you redirected it, and then show me how you supplemented it. So it wasn't just, we know you're going to use it. We want to train you to use it in the right way, and we want to know where the limitations of the tool are and how to account for those, because your answers are your own. You own them. You're accountable for them. So don't give me something where the tool has hallucinated the correct answer. We need to know that you have done your homework and that you know that that answer is correct.
Yeah, absolutely. And just to bring this back to time for a moment, space for students is one thing. Let's give them the freedom and the opportunity to have some time to engage, because faculty actually need time. If I'm going to figure out how to utilize this technology in the classroom, that takes time. And if I'm going to do it well, that takes time. And if I'm going to be able to interpret the work that I'm getting from students, so I can figure out how they're using it, and are they thinking for themselves, and are their references appropriate, then I need time to do that.
We've been talking about some examples. There's been a real interesting study that's come out from Harvard Medical School, Rao et al. It came out in this March. I'd be curious what your perspectives in the teaching context are about this. Hanan, I want to start with you. But the study, basically the research team inputted 36 clinical vignettes from a prominent clinical manual It asked ChatGPT to determine the differential diagnosis, the diagnostic testing, final diagnostic, and management based on the patient age, gender, and case study. They found that across the entire data set, ChatGPT was about 70% accurate in its inputs. However, most accurate in the final diagnosis, it took some time to get there. The initial diagnoses were usually off. You had to lead it. In this particular example, the researchers were trying to see if ChatGPT could conduct clinical decision-making tasks. And in comparison, how do you currently support your learners as they work towards improving their clinical decision-making skills?
What they usually it is about encouraging the process of critical thinking. We always know that there is a difference between a novice learner and an expert. So when you go to a dentist who's been practicing for so many years, and when he see a lesion and when he see a condition, he's directly directed towards the decision because of all those scripts in his mind or in her mind that they have gone through. With a novice learner, the process is different. We need to follow that process by step, which is called the script. So the students need to think about these symptoms, what these symptoms are, what other diagnostic information they need to get to reach to that decision. What is the differential diagnosis? So it's a detailed process till they reach to the final diagnosis. This article was very interesting, and I being a good student, I read the whole article, and I decided to sit and summarize the article in 250 words as a good student. So I summarized the article, and then I went to ChatGPT and asked ChatGPT to summarize the article for me. Although I was happy because it's a recent article, although it was able to summarize, although we know that the information is limited up to 2021, but it managed to summarize. The summary was really good, but every time I regenerate, it keeps skipping that part where the differential diagnosis is the least part that the AI was able to identify. So I'm not sure. Maybe you should also try that, but I did it twice, and that statement, which was clearly in the paper, in the conclusion, it was repeated several times within the article, was not there. So I was like, okay, is the ChatGPT biased toward ChatGPT? And then that was, but the summary, to be very, very frank, the summary was very well written, except for like hinting towards the differential diagnosis and the inability of the AI to support the proper decision making. And I totally believe that with additional information and with more training, the AI model will be able to reach at one point of time very close to right diagnosis and a proper set of differential diagnosis.
Yeah, if I could say just a couple of things about that really quickly, Hanan, I thought that was a really fun discussion there and insightful. One of the things that struck me about this is that this just feels like the tip of the iceberg. So studies at this point in time, what one takeaway from it is how remarkably successful it already is with its very limited tool set. I mean, it's a word predictor, right? So I thought one of the interesting observations of the article was near the end when it makes that point and says ChatGPT lacks reasoning capacity. And so we're sort of, we're missing something when we think about this as like it's deciding like a human would decide. It's not. It's predicting words, and those happen to have another type of predictive power. It's going to get better, but it's not going to replace reasoning capacity until sort of the model of what it's doing changes. So it's two interesting things. On the one hand, it sort of holds out hope that human beings will always be necessary as clinical diagnosticians. But on the other hand, it's remarkably successful already, and it's only going to get better, and it's going to get better very quickly.
And one important aspect, the area of knowledge, and this is what we are seeking right now. The knowledge is there. So this is what we need to rely on when we are looking into models to educate our students or to help the faculty, because I would love the critical decision making skills to remain within the students and within humans. So I would be happy to know that this is a source of reliable information, getting the knowledge, and then working these knowledge models out and make my own decision as a dentist, as a clinician. So this is what I hope for.
Which I think goes back to the point we were making earlier about people needing to know not necessarily all of the data, but how to figure out if the information they're getting is accurate and correct. So we need students and future professionals to be able to get these diagnoses or this information from the artificial intelligence systems, but then be able to figure out for themselves, okay, can I verify this?
Long time ago, we stopped remembering the lab results. We always have to decide the norm and the abnormal. So long time ago, we are slowly giving away things that we don't need to remember anymore.
Right. Could I mention another study that I think sort of piggybacks on that one? This one was in JAMA Internal Medicine, and it was published not too long ago, certainly in late 22 or early 23. But it was a study that found ChatGPT outperformed physicians in empathetic answers to patient questions. And I thought that was more interesting than the previous study, because what it really said was like it did a better job of saying things that would locate the clinical information in sort of a human-centered empathetic response. And so to take this back to like how we might use this technology, I wonder if there aren't ways we can think of it being used as a resource for teaching clinical students how to be more empathetic or better communication skills, which as a person doing medical ethics for the past 30 years is something I've always taken very seriously. There's not one size fits all for a clinician. You're not trying to turn everybody into the same type of communicator. Some people aren't going to be as warm as others. But teaching people to recognize you're talking about values and to be empathetic and to be present is important. And ChatGPT seems to be able to frame answers in ways that did a better job than a bunch of actual people involved in the study. So how can we harness that as a teaching tool?
I believe that reflection is a key part of being a good clinician. So I hope that one day this model can be where the students share their own reflection and get feedback that what went wrong in that encounter. So I said that, and how this can be improved. So these are the statements that I want to tell my patient in this particular situation. And then they receive a feedback on how they can improve. And I believe with repetition and repeating that several times, they will develop some skills to look into the bigger picture. And what I perceive empathy and again, all these things might vary from one practitioner to the other, but looking into a general model that responds to the students and give them feedback on certain situation and encounter, that could be helpful.
So Hanan is bringing up something that I wanted to talk a little bit about, which is this concept of how does ChatGPT help with the transition from novice to expert learner, right? Because that's really where we want to get, is not just that ChatGPT might be a tool for helping a learner to understand how they learn, but actually even potentially to assess the entrustability and competency of the learner. And to Greg's point, I'm not sure that we are there yet, but I definitely think that we can get there. Greg pointed out this concept that ChatGPT showed in this JAMA study that just came out, that it could develop empathetic responses that were actually preferred by quote unquote real physicians. What that tells us is that these large language learning models can determine what is competent performance in various skill sets, right? And that it can demonstrate competency in various skill sets. There's another study that came out, Greg, I don't know if you saw this one, but it just came out and it showed that ChatGPT could pass USMLE step 1, 2, and 3 with 60% accuracy without any prompting, right? So we know that given time and development, these language models can be used to make assessments. And that's a really critical thing, because right now we have a challenge in that regard, because often our assessments are based on our own lens of interpretation and observation of the learner. We often use frame of reference of ourselves. What are our perspectives? What is our competency in that? And then we make sometimes an inaccurate assessment of that learner's competency, right? We know that moving towards criterion-based assessment is really the gold standard, right? So we determine competency by whether or not someone hits the right elements as identified as being valid, right? And that's where a large learning model can essentially work as almost sort of like an autonomous interactive rubric, right? That can say, hey, Saroj, as a student, in terms of breaking bad news with this patient, you were able to perform at a certain level. And the way we know this is because you hit these elements that are validated steps to competency in that. And over time, it can also guide the learner in the next steps, i.e. giving that feedback that Hanan was talking about to help the learner progress to the next level of competency. So to extend the analogy, Saroj, one of the areas in breaking bad news that you had a challenge with was you were not very good at giving the warning shot. That's often an important element in prepping the patient for the important information that's coming next. For your next observations or your next assessments, we want you to read this article and then try giving the warning shot, right? So there's that feedback component. So I think that that's where we're going with this concept that Hanan and Greg have already codified, is the idea that we can actually use ChatGPT to sort of scaffold this progression from novice to expert.
That touches on something fundamental about healthcare, medicine, other types of professions, which is many of them are practices. We think of medicine as a practice. And what does that mean? It means this is an acquired, accumulated set of skills that interact in an organic way and that you acquire proficiency at through practice over time. So it's interesting to think of that as a type of limitation with these large language models, because they aren't reasoning. They aren't bringing that information together in an organic, interactive way. So they might be wonderful resources for particular skills, and we may even be able to combine them into something, but will they sort of approach or be able to replicate a full seasoned practitioner who is engaging a sort of human reasoning at a deeply organic, complex, interactive way to engage another human being who's approached them in this state of vulnerability?
How can we give students more and more practice without bogging down the instructors to create all of these authentic clinical situations, right? It's all about practice. Well, we could use ChatGPT to say, give us 10 different patient scenarios. They could practice developing, different diagnoses, check their answers against the output. They could go back and forth, debate which one might be better. Again, to Greg's point, practice those soft skills if they were to go back and forth and provide a response to a patient's question. But there was one more example I wanted to run by you to see what your thoughts would be. I could envision a student inputting a prompt similar to this one. Teach me how to do X, or teach me how X works by asking questions that test my understanding of the key concepts. With my answers, teach me what I don't yet know, and then continue asking me questions until I show mastery of the topic. This might allow our students to practice anywhere, anytime. What do you think of this type of virtual tutoring? And do you see an application for you?
I believe that I go back to your first part where you think that how we get the students to a mastery level. So for example, in my course, I have standardized patient encounters. And the students meet with the standardized patient, and the standardized patient do the evaluation, assess their communication, professionalism, listening skills, and so on. I would try to provide feedback to those who scores the least within the class, but I would not be able to. I will watch as many videos as I can, those high scorers, those who don't score that well. But if I can provide a platform for those who don't score up to what I want in those encounters, to take that scenario and feed that scenario to an AI, and I will tell them, keep looking into what went wrong with that scenario till you feel confident. And then I will have another encounter with you with a real patient to see how improve, or to see the improvement in that aspect. So I would love to see that situation where I send them back to where they can improve that skill, and then I will assess them again and provide more guidance. So I think if this can be achieved in our learning environment, that would be something amazing, because you're not leaving them. They say that, or the AI said that they have reached their mastery level, but I will still need to bring them back and assess them in the setup where they are going to be with, like a real in-person encounter with a real patient.
Yeah, and along with Hanan's saying, I don't think this is an either or. I don't think we have to say it's either the AI determines competency or a real world scenario with a competent professional determines competency. I think it's an and also. And I think that's really, really important. So I think what you're really talking about there is a fascinating advanced version. We're not there yet, but where we're actually having the system program itself to teach us what we need to know. And I think the other fascinating thing about this is, a lot of people are worried about these kind of AI models being used to quote unquote cheat, right? But I actually think just the opposite, because if the AI model can generate an infinite number of scenarios that test the same concepts, then no student is going to be able to necessarily see the same scenario that another student saw. And what eventually is going to happen is students are going to realize that they have to learn the central underlying concept if they truly want to pass the scenarios that are being put forward by the AI.
But I will still want to test or assess the student in the real environment where they are going to be, because their patients is not going to be a virtual patient. Their patient is going to be a real human being. And the feedback that I get from the standardized patient, or even their real patient when they go to the clinic, that becomes the real thing.
Is the way in which we can use, I think we touched on scaffolding earlier, but we can use this as a tool, not just like flashcards where students always go back to the one that they remember the best, right? That's not a really effective strategy for studying. Instead, can the tool, I think we've all kind of touched on it, can the tool help students really focus on where those learning gaps are the greatest, come back or provide feedback to the instructor, bringing in those really effective studying skills, and then also maybe thinking suggestions of ways they can think about this happening in the real world. Again, kind of always bringing it back to that authentic assessment. And I know that in our previous episode, we heard a little bit about how students can really play with the tool, right? The power in which they can say, all right, now do this. Now write it this way. Now let me see, it's not a 75-year-old patient, it's a 6-year-old patient. And so maybe that's an opportunity for students to really engage in creativity, to play around with the tool, and all the while they're studying, right? But it's also kind of modeling some of those authentic scenarios.
Yeah, I think this goes back to a little bit of what I was alluding to in the beginning about the potential for the immersive nature. I mean, suppose I was exploring a case scenario and I decided to start playing with the parameters, right? I said, well, what would happen if I gave this symptom, or if I gave this medication, or why isn't this the right answer? I get to start playing with it. And then in doing that, maybe I start following a different path for a little while because I'm interested in the information that came back when I introduced a new symptom. So I go down that road for a bit. And it broadens what I might get exposed to, but it also empowers me as a learner, and it creates a certain playfulness, which I think can really encourage people. And we know enough about when things stick in people's heads to know that type of variability is helpful for remembering, and both short-term and long-term.
And Greg, I want to segue slightly here about this immersive affective ability that ChatGPT offers our students into creating a new way of studying and learning clinical reasoning skills. So we shared the article, Ali et al. That just came out just this year by Lancet publication that describes a study how they use ChatGPT to generate clinical letters. Hopefully you're familiar with this. Specifically, the authors question whether natural language processing could disrupt the time-consuming and often arduous process of preparing clinical letters to be shared with patients. OpenAI's ChatGPT generated a bunch of clinical letters for patients with limited clinical understanding that they were being evaluated on readability, factual accurateness, correctness, and humanness. The author's objective was to evaluate the potential using this tool to produce high quality clinical letters that patients could understand while improving efficiency, consistency, accuracy, these type of things. So this example to me kind of segues everything that we've kind of talked about up to this point about the ability for AI to generate fluent sounding text related to health science topics. There have been other examples that have been shown to show how ChatGPT can also summarize content at a particular reading level. You may remember Dr. Behrens from the previous episode talk about how they were writing press releases for a 2-year second grader, right? So with that being in your mind, what implications or applications do you think this second, almost third, this is the third study we're talking about now. How does this, what does this mean to you? How can we leverage this tool to help our students develop that humanness? Hanan, you brought that up too, is that our patients are human. What can this help us in that way, would you say, Hanan?
I believe that this is a step forward because, again, the AI will not be only for students and educators, it's going to be available for patients as well. And it is also learning their pattern and how people will interact with the machine based on their health literacy. So health literacy is very important aspect of addressing the patient's needs and how to manage them. So there is a great potential for AI to support patients as well, explain concepts for them. Now patients come to the clinic, they know about most of the procedure because they Google them, they get the right information, they get the wrong information. But if we know that there is a platform where patients get the right information, where patient can be it explains the concept based on their understanding, their level of understanding. So, and this is what this paper is about. It looked into the patient's knowledge and their ability to understand. So I believe that there is a great potential in that aspect, because it's again back to time saving, because if these letters are auto-generated or generated by AI, that means they save a lot of time for the practitioners and the healthcare institute to look into that. But on the other hand, we and they have mentioned that towards the end, we need to weigh the potential risk when we are using this technology and providing it with a lot of information about patients. And some of these information needs to be protected. So this is where again, the boundaries and the limitations come. We need to understand to what extent. I totally agree that it should generate a set of templates. So this is grade 1 education, this is level 2 of education, this is a very well-educated patient, but I don't want those to be personalized to the patients at this point of time when we don't know how ethically these systems are when it comes to patients' confidentiality.
It's interesting, because really, Hanan, I think what you're saying is it's not that this is bad. It's just that we don't know the full extent of, and again, those boundaries. What's fascinating about this, and if I can tie this back to the study that Greg mentioned earlier, the one that was writing responses to patients about their diagnoses, and that they were judged to be more empathetic and humanistic. There definitely is that potential, though, for time saving, and for the clinician, the busy clinicians. That's a really critical thing, because there's one thing that ChatGPT doesn't do that humans do. We get burned out. We get frustrated. And when we know that when we get burned out and frustrated, the quality of our responses and our choices declines, right? With large language models and AIs like this, that quality declination doesn't occur. To your point, Hanan, I will also point out that there are 3 systems right now. So University of California, San Diego, University of Washington, and Stanford, all 3 are now piloting programs with responses to patients in an effort to determine how effective is this when we do it outside of a limited study and look at larger scale and things like that. Certainly not, system-wide yet, but I think what you're talking about is exactly the thing that's driving some of the higher educational institutions to utilize their health systems as the testing ground for, can we do this? And will it eventually save physicians time by handling things with the same degree of competency and maybe even empathy and humanism as the physician themselves?
So if I could piggyback on that, I don't think there's a university in the country, or probably the world, that isn't recognizing and struggling with changing writing skills in the student population. So I'm wary of endorsing technology that's going to do the writing for students, because that we already struggle. And I think reading and writing are essential parts of understanding. You write as a tool to figure out what it is you know and are trying to say. Having said that, I think that many clinicians find the non-clinical aspect of their work to be more time than ever, and a huge drain on their mental and physical capacities. So tools like this that can alleviate some of that burden and take some of that responsibility are important. I think we have to keep in mind that at this point in time, these systems still reflect the bias and inaccuracies of the source material that they're drawing upon. So obviously we want to continue to improve them.
It can be really vulnerable to critique your peers, especially if you don't know them, especially in an online environment where you may never have seen that person face to face. So could this potentially play a role in helping students practice those skills before they engage with critiquing one another, and scaffolding that part of the educational experience?
Yes, I think that's a great question, and I think you provided the answer. It seems to me to go back to something we had mentioned previously, which is give the student the opportunity to sort of create something and then use AI to engage it and get information back on what they did and how they might improve it. Maybe then turn in something that shows us the process of draft and revision, and utilizing the AI tools as part of that. Having students evaluate each other's work and provide feedback on it is a real mixed bag. Some people love doing it. A lot of people, you have to have a bit of a thick skin. A lot of people take it personally. A lot of people are hesitant to say anything too critical, so you get a lot of sort of meaningless praise. You made the point, Suraj, that AI doesn't get exhausted or burn out. It might also at times be a little more willing to tell somebody what they did wrong or poorly. So that could be a helpful, say it empathetically, but do tell them something that they could improve. Also, sometimes students might take it better if it's a machine saying, hey, I noticed that, this language was a little rough. Whereas if a person says it to them, it feels like that person is judging them. So I think there's a lot of room here for incorporating this AI feedback and interactive multiple sort of drafts, if you will, in productive ways. And again, echoing the idea that we might say to students, craft this sort of campaign and create multiple tools for communicating with an audience. And to be honest, a lot of students really struggle with that. They don't have great public communication skills. They don't have great writing skills, and they're working on them. They're improving them. So a tool that they could access quickly as they're doing it multiple times would be a really helpful tool.
I was also thinking it would be interesting if you ask a group of students to look into education campaign or a health promotion campaign for different group of audience using the Chat GPT, each group with a different group of audience, and they come together and compare and contrast why these programs or why these promotion campaigns are different for this group of audience and compared to that. And that would be a learning process. So they are not developing, they are looking into what has been developed by AI and learning from comparing what is existing.
Now, you bring up a lot of really good points. All of you, some of the information that we're going to get is probably going to maybe have bias. We need to have go into that with open eyes and teach our students to do the same. And you all brought up a really good point. It's not just the students we have to prepare. We have to prepare our patients. And we need to model how those interactions happen in front of our students. Then they will know how to handle those types of conversations. So no, all really good points. And I just want to kind of bring it back to, if you've paid attention to the media and the news, you're seeing calls for a moratorium. You're seeing calls for, we need some major guidelines about how AI is going to be used, not just in education, but in a broader context. So I think that the idea is be excited about this tool, but just be cautious. And we don't want to go all in until we fully understand how it is that it's going to work, what, again, the future applications are. So just proceed with caution, I think.
Good. I'd just like to throw in the thought that escaped my mind for a second there. I'd like to remind the audience that AT still teaches health science students, and not all of those students are clinical students. I work in a public health program, and my students generally aren't interacting with patients of theirs, though we have clinicians who have public health degrees as well. But AI as a resource for the public health students, especially when it comes to communicating with certain populations, is incredibly important. How do we create materials that are persuasive, that are written in a way that's understandable, that use clear, easy to read language that's well written and punctuated properly? These tools are great for non-clinical students as well who are in the health sciences. So just want to make that point. We're not just talking about patients here.
Brittany's comment, because I thought it was particularly telling, and I think it's a nice way to encapsulate a lot of what we've said this evening, which is that we really do want to see full-scale integration and adoption, because this is not going to go away. The analogy that most clearly associates with the introduction of AI language models is the introduction of the internet, for so many of the reasons that we've already talked about, that this concept of data retrieval, information, connections, and synthesis and things like that. But I think Brittany's point about the fact that we need to do a lot of thinking, right? And this goes back to this metacognitive process of thinking about what do we really want to do with it, not what can we do with it, because we can do almost anything with this depending on the direction we choose. It generates and it chooses to go. But we really need to spend our time thinking about what do we want to do with it first. And that, I think, then helps us to set those boundaries and set those goals and directs the initial phases of how the development of these large language models are going to go in terms of the second generation. And then I think over time, probably long after we're all gone, we're going to see that initial investment in the thought processes is going to pay off yield that we can't even comprehend in terms of the downstream effects for the efficacy of these and potentially avoiding some of the dangers. So thinking, more thinking, more thinking.
And to get to this idea, then I would like to revisit a question we asked towards the top of today's episode. I'm wondering if anything has changed for you and how you see the tool or how you understand the role of educators in preparing our students. Is there anything that has come up in this conversation that you're reflecting on or has modified your original response to the question, what is our role as educators in preparing our students now that ChatGPT and everything that we think is going to come afterwards? What do we think about that?
Well, I'll start by saying that I have to tell you, I think having Hanan's perspective, especially that research perspective, and making sure that we are thoughtful about the essential skills of research that need to be present, because ChatGPT seems like such an obvious tool that could do so much of our baseline work in research. But Hanan made some very good points about, what do we give up if we don't learn that basic language of research and those basic research concepts? We essentially lose our ability to assess whether the research that's being put out by others or even ChatGPT itself has utility and validity. So I really appreciate Hanan's comments in that domain, because I think that's something that for me is very, very important.
Hanan, how would you like to accept that compliment? And we'll come to you, Greg.
I'm happy to hear that. I always, that was my struggle when I said, like, what should I do? I teach evidence-based dentistry. Which part should I give away for AI and which part should I keep? So I believe that we cannot reach a decision now, but we will have to explore and see where this technology is heading and how we can best benefit from this technology, because definitely, as we discussed, it has great potentials.
Great.
I would like to say that this conversation has caused me to remember how important it is to have teachers and the value of education. It seems to me that culturally we're moving towards the idea that education is teaching people pieces of information or how to ply a trade. And schools are being underfunded, educators are being underfunded. The value of a person engaging a student in critical thinking and challenging ideas and causing them to question the big picture, the way they see things, that's fundamental to the educational process. And ChatGPT is going to be able to do a lot of things, but I don't think it's going to be able, at least in the near future, to supplant that lived experience of a student in being challenged and engaging. And it's not just memorizing. I think it's so funny that people believe the study of history is memorizing facts about the past, when that is not what it is at all. So this conversation, it's invigorated me, because it reminds me how much I enjoy this deep piece of being an educator and what we as people bring to the students that we engage.
Greg, what you know is that all the rest of us are actually AI models, and you've just been talking with 5. No, I'm kidding. Sorry, Quincy, go ahead.
No, that's brilliant. I was just going to say it is an exciting time in human history for sure. I'm so excited. I'm also very elated about what's to come next. I think the future is bright, and that there'll be some things that we have to work through. I think that's something that I got out of this conversation. Thank you.
Yeah, thank everyone. It was a great conversation.
Thank you.
Thank you.
Before we go, I want to offer special thanks to today's guests, Drs. Greg Lobin, Saroj Mishra, and Hanan Omar. Thank you for sharing your interesting and informative perspectives with us today. Thank you, Ms. Brenda Jackson, for keeping the TLC running smoothly. I want to shout out to Dr. Don Altman. Thank you for your leadership and support. And of course, thank you to my colleagues, Brittany and Julie. Thank you for all the support, all the great questions and dialogue today. Last but not least, I want to thank you, the listeners. Thank you for taking time to tune in to hear this engaging, exciting conversation here with us. We look forward to your reactions, your comments, your questions. Be sure to hit like if you liked it, and make sure to add your comments below too. We'd like to hear from you and what your major takeaways are from today's episode. For those interested in receiving credit towards the Level Up Certificate Program, we've included a link in the comments below, where by clicking that link, you can let us know that you've listened in, and we'll apply those credits towards the level 2 technology level. We hope you enjoyed the conversation. We have another episode in store for you. Please tune in for that. Until then, this is your friendly TLC team, Brittany, Julie, Brenda, and myself, Quincy, signing off. Ciao for now.